Hello, everybody. Again, this is Clinton, and I'm with United Insurance. Today, we are going to discuss Part D with Medicare. If you don't know, that is your prescription drug plan with Medicare.
Hi everyone, my name is Damian Delisser. I'm also with United Insurance. I have been doing this for about 20 years. A lot of my insurance expertise falls within senior market products, so I'll be discussing Part D with my associate Clinton today, and hopefully we can clear up some of the confusion that's out there.
Yes, because I definitely have questions.
Awesome, let's go.
So, just to start off, can you just explain what Medicare Part D is for everybody?
Yeah, so Medicare Part D is prescription drugs. Everyone out there has to have a prescription drug program. If you don't have group coverage, you don't have coverage for drugs through your retirement or through your spouse's retirement, you have to have a prescription drug plan.
And why do we have to have a viable prescription drug plan?
Because if not, you get hit with a 1% penalty, and that penalty is of the national average, which is $32. So 1% of 32 for every month after 63 days that you didn't get your Part D coverage in place, they can penalize you. And guess what?
Doesn't go away, correct?
Unless you qualify for LIS, and then they'll erase the penalty. LIS, in case people don't know, it stands for low income subsidy or extra help. You have to go through your state for that, and it's usually covered within your state pharmaceutical assistance program.
Right.
So that's kind of the rules for Part D is you kind of have to get it. You have to address the ugly kid in the room.
Right.
Yeah. Part D comes with, by itself, a standalone product, or you can get it with a Medicare Advantage prescription drug plan. And your premiums are going to start off about $7 a month, and they go all the way up into the hundreds, depending on your drug list.
I've seen some that
Scary,
go all the
right?
way up into the hundreds.
Scary. So, what we use is we use a software where I type in your zip code, okay?
Right.
I ask you for your medications that you take, your dosage and your frequency, and then obviously what pharmacy you use, and we discuss what's called a preferred pharmacy. For people that don't know, a preferred pharmacy is a pharmacy that is in network with that particular drug plan, meaning they give you a break based on the fact that that drug plan brings a lot of participants to the table. Okay.
And just to touch on that before we move forward with the preferred pharmacy, would you say that some plans and pharmacies are better than others, or are they all about the same?
No, I think, that's one of the better subjects I think you brought up, Clint, and let me explain why. Drugs are built on lists. Those lists are called formularies.
Right.
Every carrier has to have certain drugs for each class on their formulary. So preferred generics are tier 1 drugs. Generics are tier 2 drugs. Preferred brand are tier 3 drugs. And then brand is tier 4. And then tier 5 are your designer drugs.
Correct.
Right? So each carrier that's offering you a Part D plan through Medicare, they have to offer you a certain amount of drugs per tier for each class. So if you have high blood pressure or cholesterol or heart disease or diabetes, they have to offer a certain amount of drugs per plan, right? So I think it's for you and I and newer agents dealing with the customer, your drug list, if you're on a lot of medications, can make or break the situation. So understanding when to put tablet versus capsule, understanding how to do the correct dosage and frequency, asking these questions and making sure that you're very, very, very accurate and detailed with your client protects them, right? Wouldn't you agree?
I would totally agree with that. I've had clients where their drug list cost them so much money that they weren't able to even go put gas in their car at the end of the month. So
That's sad, right?
it's very sad.
Yeah, I mean, the only way around that is knowing what to offer your clients and how to offer it. Like, sometimes I'll tell people you need to go to your pharmacy and get them to fill out a formulary exemption. They don't understand what that is, but you just have to explain to them. That's them getting them to add that drug to their list just so you can drop that drug a tier and make it more affordable for you.
At least get it to where it's affordable, right?
I guess the better news in this, Clint, for your clients and mine is the fact that At the end of the day, these drug plans are actually better than most of the private plans are out there. And they're 9 times out of 10. I don't know about you, but for me, when I'm speaking to people at the end of the conversation, I've saved them money on their prescriptions.
Well, that's our goal, isn't it? Our goal is to help save our clients
You're
money
right about that.
on their medical costs and, of course, their medication costs.
So, I mean, my thing is, how do you explain to your clients what's the difference between a copay and a deductible?
Well, the deductible is what you pay up front so that the insurance would cover the rest.
So, if I was to quiz you, would you say that most drug plans exclude tier 1 and tier 2 drugs from the deductible?
When we're talking about Medicare C,
Or prescription drug plan. Tier 1 and tier 2 drugs are generic and preferred generic. Do you think that they apply those?
most of them, yes, they exclude the deductible.
I found
for
the same
that.
thing.
And then once you get to those designer, those higher drugs, once you jump to tier 3, I believe that's when you start paying against the deductible.
Let's say I take a blood pressure medication. Maybe the same one you take, maybe a different one.
Okay.
But, you know, when I look on GoodRx, it says that it's a generic. What would you think my copay would be for something like that? If you were to give me a price range, just say I went to Walgreens.
I would say with Medicare, we're looking anywhere from $0 to maybe $3
Wow, that's cheap.
for a generic blood pressure medication. Yeah, I would say $0 to maybe $3.
Okay, so like let's say for instance, you know someone that's a diabetic, like I do.
Yeah, myself.
Exactly. What could you expect that to hit the pocket?
Well, depending on the type of insulin or the type of medication that you're on,
Right.
it can range anywhere from $47 to almost, it can go up into the hundreds. I've seen it go up into the hundreds.
But you know that there are plans that are catered towards diabetics, right?
Yeah, there are some
I know you
plans
do.
that are catered towards diabetics, and even the manufacturers actually have plans themselves that
Right.
help out.
What's the problem with those manufacturer plans though? When you turn 65, they don't honor them anymore.
Oh, because you're considered on Medicare A and B.
That's the problem, right?
Yeah.
I get it. I get it. So, how do you think, when you break it down to people, how do you think that you're doing the best service for them on their drug list? Is it by talking to them about their drug list, or is it just pairing them with the best pharmacy and the best plan based on the list they're taking?
I think it's all together. We got to have the conversation,
Yep.
number one, and it's got to be an accurate conversation. So our clients have to feel comfortable in actually giving us the accurate information so that we can have
How long they've been on it? Why?
why they're on it. Is there another alternative?
That's huge. That's
Because
huge.
if you're not having that conversation, how do you know to go to your doctor and even ask for help?
Yeah, and magnifying the importance of them knowing the exact dosage and frequency of the medication. If it's a pain management medication, you know all the restrictions that we're dealing with that. I
Yeah.
mean, unfortunately, there's people that don't do it for the right reasons, right? I think a couple things I'd like to touch on before we sign off for today is, if you do qualify for extra help, that does make your deductible go away. It does make you have a set price bulletin depending on what level of extra help you get. So I'm sure you push your clients to get that done because it's free to ask for it. Why not get it?
I mean, all they can say is no, right?
Right, exactly.
That's
Right.
my line for all my clients. All
Exactly.
they can say is no.
Right. You can, as my dad would say, you can lead a horse to water. You just can't make him drink
it.
100%, brother, 100%. Well,
I
that's
have
it
one
for part D today. Join us again sometime soon in the near future. We're going to discuss Medicare supplements for you. If you have any questions or you'd like to retouch on this video, go to our website at myunitedinsurance.com. There's plenty of content there and information for you to research on. And our direct number is 1-800-339-4112. Thanks for your time.
Thank you, everybody.